The Assam State report, based on the National Mental Health Survey of India, has stated that substance use disorder among young people of Assam has become a public health issue. And this has also been reiterated in the United Nations International Convention Article 47, where they have said that it is important to take certain strategies to reduce supply and demand and harm reduction. And this is a three-pronged strategy that they have taken up. The big picture research work from University of Leeds of School of Psychology, led by Anna Madill, has also done a similar kind of work, and they have thought about it in order to understand how young people of Assam are looking at substance use disorder.
The big picture research from the School of Psychology at the University of Leeds in the UK is a project funded by the UK Research and Innovation Global Challenges Research Fund. It's a project with Assamese youth looking at how to prevent and support recovery of young people from substance misuse. Our partners in Assam are Mind India, which is the Institute of Positive Mental Health and Research, and Nirmaan Rehabilitation Centre, both operating out of Guwahati in Assam.
Listening to young people and developing service for them by speaking with them is deemed to be the best practice in global health. Hence, we seek to understand by taking two groups. First one is between 15 to 18 years who are at risk of substance abuse, but somehow they manage not to take it, and a group of people aged between 19 to 24 who were at risk but they took the substances and have a treatment in some rehab, but now they are clean. Our goal is to increase knowledge, promote the policy into practice, and to generate awareness to the young people of Assam.
Based on the outcome of the research work, it is suggested to develop a policy for alcohol and substance use rehabilitation so that there is a standard of delivery of services and of accountability. The following implications for inclusion in the policy are suggested as follows.
One of the important areas that can be looked at is awareness program for all stakeholders, which includes peers, family and community. We have understood that positive role model has a very important role to play in substance use disorder reduction, and this can be done through peer-to-peer education.
Investment in peer-to-peer education and support and presenting positive peer role models are likely a cost-effective and productive means of preventing substance use disorder in young people. It is also essential to sustaining sobriety when young people are in recovery from addiction. Hence, the strategies of awareness and advocacy needs to include positive role models.
The rehabilitation centers have been manned by volunteers who are already recovering addicts, and they have been doing a fantastic work. But so that we can sustain sobriety, long-term psychosocial support and counseling training can be provided to all the personnel who are manning these rehabilitation services and centers.
Women suffering addiction face particular stigma and health risks, yet few rehab services cater to their needs. Investment in women's services will contribute also to the well-being of their current and future children. Thus, women-centric rehabilitation centres are required.
Most of these organizations which are running the rehabilitation centers are NGOs, and sometimes financial difficulties are also faced by them. Thus, grants or aids can be provided by Government of Assam so that they can provide the adequate support and services which is required. And lastly, a third-party monitoring group can be also encouraged so that we are able to understand that the policy has been taken in place and it has been able to implement the way it should be in all the rehab centers of Assam.
আহক আমি সকলোৱে একেলগে মিলি অসমক নিচামুক্ত কৰোঁ। ধন্যবাদ।